and we're here today to discuss European Perspectives, which is a new initiative for the oncologist. And this initiative is really centred on European oncology community and what we can do to help the European oncology community and to discuss the important issues that are particularly relevant to European cancer care and cancer research. And on my left we have Paddy Johnston, who's the European co-editor of The Oncologist, and then Pierfranco Conte, who has just joined us, who is section co-editor of the European Perspectives. Thierry Le Chevalier, who is also section co-editor of the European Perspectives of The Oncologist. And finally, Bob Pinedo, who is European co-editor of The Oncologist. Bob, given your position as European co-editor of The Oncologist, what role do you think European Perspectives can play for the European oncology community?
Mark, I think there is a tremendous role for the European perspective, and that's because the oncologist is offering the possibilities to contact with each other. Let's take, for instance, besides the paper edition, we have the web, we have the iPad, we have the mobile, we have access to the CME, and these are things that are moving in Europe, and from country to country it differs, and we would like to let these countries and our colleagues out there, not only in the institutions, to interact, to get to know what's going on, and to participate. And if you look at the standard of oncology, patient care, and translational research and basic research in Europe, it has been lifted in the past 10 years tremendously, and there is no need to go away from Europe. So let's contact each other within Europe and help each other within Europe wherever the focus is. Look at the focus and help from there. So I think with the mobile again, and the iPad again, and the access to the CME, we have a tremendous opportunity to help each other and to communicate with each other. And that's what we want to achieve with our European edition, considering the quality of the science, the quality of the patient care, and remember one thing, whatever science we do, whatever translational research we are participating in, the focus is the patient. We always wonder, where is the patient? It's not where is the organ, where is the patient? And that's one thing we want to keep all over Europe and to help each other in remembering that as well, besides the techniques and the ways to treat the patients, which are cutting edge anyway.
It's a very important point you raised. So really it's putting the patient at the centre of the translational process.
Yes. Translational research is so focused on the molecule often that one may tend to move away from the patient. What we do is keep the patient there while you are doing the translational research.
Thierry, in Europe we have special issues that we face in relation to cancer care, cancer disparities, quality of life, equal access to care, things like rapid access to innovative drugs. How do you think European Perspectives can confront these very important issues?
I think that we are pretty lucky in Europe to have a very social and well-organized medicine in most countries. So there are still disparities. There is not a perfect access to everything everywhere, but it's pretty well and better organized. I think that there may be in the community some perplexity about the priority that should be given with all the amount of new information that we have in the so-called gene-driven new treatments. And I think that perspectives offer this the European perspective, offer a unique opportunity for the community to be informed about the priorities, what should be given in the 500 million inhabitants of Europe, and which are the opportunities that may be developed in the next future. So we have an exceptional opportunity to inform the general population of medical oncologists and their patients.
Picking up on Thierry's comment there in relation to European oncology, Bob, you highlighted in the article the 50th anniversary of the EURTC as being an incredibly important part of the overall oncology story, both Europe-wide and also internationally wide. What do you think have been some of the key achievements of EURTC over the last 50 years?
It's a very important question, and I think, first of all, I joined the EURTC when it was 10 years old. So in 72, it was quite different. But I saw a growth over the years, which was tremendous. And what you see, what the EURTC achieved is bringing the oncologists together through clinical trials. And the clinical trials have been improving more and more, and the clinical trials are high quality. Clinical trials randomize the patients from, sometimes, if it's a phase 3 trial, from treatment A to treatment B. But one thing we saw growing over the years is that the quality of life of the patient was emphasized more and more. And there was a quality of life group and the quality of life expertise growing and growing through all those clinical trials. And that means that the patient was not lost through the randomization between A and B. The patient was centrally again in the clinic, and the doctors out there were confronted with the questions about the quality of life of their patients. And so that grew and grew, and what I think is that through these clinical trials, the quality of the treatment of the patient improves overall Europe. But of course you keep some niches that we can help, many niches in Europe, because nothing is equal. And everything can be raised more and more, also in the institutes. So I think the EURTC is offers a way to improve the quality of patient care and quality of the patient life. And so I think it's a great organization. If you compare it with other similar organizations, the patient remains centrally.
It's very interesting, and we'll hear more about the EURTC, and our readers will be able to read more about the EURTC in future articles. Pierfranco, as section co-editor, what are your aims and ambitions for European perspectives?
But I do really believe that this is a very important initiative, because in fact in Europe we are still in the middle of the way to a European community, to establish a true European community. We start from very different situations, difference in education, difference in epidemiology, difference in the way the national health system reimburses drugs. And there are some common rules, of course. So we have the European Medical Agency, which establishes which drug should be approved in Europe. But again, at the national level, the health systems decide which drug will be in fact reimbursed to the patients. So I really believe that we have to, on one side, raise the scientific level of a European oncology community. On the other side, recognize that there are differences which are important and will remain important, because even the perception of cancer is different across Europe. Northern European patients are different from Southern European patients. The way the national health systems are organized is, and probably will still remain for many years, different across Europe. So we must be able to take the right data coming out from clinical trials and to adapt this data to not European but different European situations.
Okay, that's very interesting. I suppose it reflects as well the genetic diversity that we see in Europe. Touching on that point, Paddy, we've talked a lot in relation to cancer care and access to care and the potential inequalities of care. The other area, obviously, that European Perspectives will address is in relation to cancer research. And what do you think are the challenges there, and how do you think European Perspectives can in some way help to address these challenges?
Well, research and cancer research in Europe is a really challenging issue right now. As I've already said, I think part of the unique objective of European Perspectives and also of the oncologist is to make that research alive for both the practicing oncologist but also for the patient, and to make sure that the research findings and advances get down to the patient level as quickly as possible. Cancer research globally is becoming much more competitive. It's becoming much more complex as well, because our definition of disease, our definition of cancer is becoming more complex. It's no longer just a somatic definition of disease. We have to take on board both issues around cancer genomics. We have to look at signaling pathways, kinases, and begin to understand those in the patient context. And that's where the real challenge lies, because that's going to demand a much greater complexity both to the science itself but also to the execution of clinical trials. And what that demands of all of us within Europe is that we work more closely together, building on the advances that Bob has already alluded to through the EURTC, so that we actually work together, bringing our various patients from different countries, but working in harmony and working as teams for the betterment of patient care. And I think that's the real challenge, is how do we do that, do it efficiently, and do it in a way that brings real benefit to patients quickly.
A final question for you all. We're launching this initiative with the first article, European Perspectives, a dialogue with the European cancer community. If you look forward 12 months, how do you think we will be able to judge whether we've been successful or not in this initiative, and all the different aspirations that you've indicated in your conversation here today? And maybe, Paddy, you might start off the conversation in relation to that.
Well, I think the success of this will be if we see the European oncology community engaging in the dialogue with European Perspectives and with the journal, its editorial board. We have given very careful thought in the planning for this to those topics, at least initially, that we believe to be highly relevant. We want to engage now with the European oncology community and indeed the patient community as well in taking this forward. So I think the metric of success I will be looking for in 12 months' time is, has the European oncology community engaged with us in the European Perspectives and in taking this forward?
And obviously one of the ways we'll be able to do that is with the online component and a two-way interaction. Bob, do you think that's a good way?
I think that's a very good way to measure it, how it's working. And I mentioned already the iPad and the mobile, and I think that's a way to measure because what we are aiming at is not only to have the article, the important article of a European discussed in the editorial, but we are also aiming to put it on the web, and people can just look at the article on their iPad and look at the comments on the article on the iPad, and the frequency you will see. I mean, it's a continuous, it's a daily happening. Thousands of people, millions of people will be looking at what's going on in the European edition, and I think we have to be, we will be very successful in this, because now already we are noticing that there is a need for it, and there is no other similar example going on. We have that existing already, and it will move on from here to 12 months further. We can easily measure it.
Okay. Thierry, as section co-editor, how will you judge its success in 12 months' time?
I think that I fully agree with Paddy and Bob. We all agree with that. I would say that from my personal experience, I would be happy if few colleagues asking for second opinions, which is very frequent in our clinical practice, just speak about this new way about the European perspective, and the journalist says, "But I wrote that, I said that, and what do you think about it, etc., etc." Up to now, I think that the journal was mostly turned toward the North America, and that it works very well, and that would be great to have few examples in the next few months, examples of colleagues working in the community and using European perspective in their clinical practice.
Very good. And Pier Franco, just to add on to that, and also you as section co-editor, obviously one of the challenges is that we want to get added value from it in relation to where we are now. Where do you think we can go in relation to that? What added value do you think European Perspectives is going to give to the European oncology community?
Well, of course, all the intelligent comments have already been made, so I can add very little just to be sure not to make stupid comments on that. Again, I think that it is for us, for our colleagues, for our patients, a true opportunity to recognize and acknowledge that there are differences across Europe, that not all these differences are bad. Some of them are good, because they take into account differences in education, differences in perception of the disease, differences in the health systems. So I believe that in the next 12 months we should be able to capture which of these differences are important for patient care, how to deal from one side, from evidence coming from clinical trials, and from the other side, local, regional, and national situations which might hamper or might require some changes in the approach in spite of the scientific data. So we should be able to translate efficacy, which means data in the ideal world for the ideal patients with ideal treatment, into effectiveness, which means to move from the ideal world to the real world of the daily patients.
Absolutely, because I think at the end of the day, and I think you've all reflected this in your comments, it's the patient who's at the centre of the process. I'd like to thank you all for this conversation today. It's been very enlightening. And we look forward to interacting with you, the reader, as we establish this two-way dialogue with the European oncology community.